not, hey, stick around anyway. We're covering some great information today. So welcome. Thanks for joining us. And it looks like we've got people live and on board with us. So glad to see people joining us. Dr. Saunders, how are things in beautiful Southern California today?
Oh, Santa Barbara is great today. It's really foggy, but when you come over the mountains, you can see the fog over the ocean and then the islands poking up through the fog. It's really beautiful. I love it.
Yes. It makes a great backdrop for you too. Just kind of the mist behind you. It's like the glory cloud. So
yeah.
Yes. All right. Well, hey, let us get started. Today we are going to talk about the brain and diabetes and Alzheimer's and things that are related to that. So before we get started, I do want to read a quick disclaimer. So we're making this video available for informational and educational purposes only, not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Don't disregard professional medical advice or delay in seeking it because of something you've read or seen here. All right. With that said, Dr. Saunders, let's jump right into it. So talk about diabetes and our brains. What can you share? What's on the top of your mind here?
Well, this is actually a really important topic, and it's been known for many years. In fact, many researchers have considered diabetes or Alzheimer's disease or some types of dementia to be type 3 diabetes. So you have type 1 diabetes where the pancreas doesn't make insulin and the blood sugar goes up. And then there's type 2 diabetes, which has a lot of different effects on the body. It's the metabolic type of diabetes. And then diabetes type 3 is Alzheimer's disease. And the reason that was named a different type of diabetes by some people is because sometimes it's the only manifestation of the metabolic problem that is diabetes. So we look at the blood sugar going up, for example, and that may be not the first symptom or sign. And sometimes the first sign is neuropathy or a problem with the nervous system, and may show up as problems with memory or problems with cognitive function, the ability for the brain to think clearly. Excuse me. Diabetes type 2 is sort of the underlying metabolic problem that creates this Alzheimer's disease. And it's not truly Alzheimer's, it's a dementia, and it's the brain not functioning well. When there's not enough energy getting to the brain, it just doesn't function. And so what is type 2 diabetes is a problem with energy production and function. So one of the things that happens is because the insulin is always high, people lose the ability to use fat for energy. And that's one of the reasons people gain a lot of weight. So when you can't use fat for energy, then you're limited to only using sugar, which is sort of a high octane fuel and causes certain types of damage. Whereas as when you're burning fat, you make something called ketones, which is a low octane fuel and allows the brain to repair and clean out. So you just never get that repairing and cleaning out function, which gradually leads to dysfunction in the central nervous system.
Yeah, okay. Well, it's really important because Alzheimer's, I don't know the exact statistics, but Alzheimer's rates in our population have been increasing dramatically. And I just saw something yesterday that said Alzheimer's is going to double again over the next 20 years. So yeah, this is just the beginning.
And what's interesting is a lot of that is because of these metabolic problems or this, type 3 diabetes, because so many people are have that and they're gaining weight and their nervous system isn't functioning. And so as we're seeing the metabolic problems go up, there's a delay, and we're going to start seeing the Alzheimer's disease go up with it.
Yeah, because it doesn't happen overnight. That's one of the troubles with diabetes, even and Alzheimer's both, is that this is something that happens after years and years of various causes and things like that. So so maybe you could talk about let's first talk about prevention. Like what is the best thing that we can do, or things that we should be doing to prevent ourselves from ever having dementia or Alzheimer's or any brain related health issues?
Excuse me. That is a really important thing, because if you wait till you already have it, it's really hard to reverse it. But if you start early and prevent it, then it's actually really easy. It's not really a problem. And the simplest way to prevent this Alzheimer's or dementia problem is to burn fat occasionally. And so we're eating all the time. We're taking in food every day. I don't know, all day long. And when we eat more than we're using, then we store it as fat. So we have this fat being stored on our bodies, and we keep storing more and more and more, but we don't use it. And so if we want to prevent Alzheimer's disease, we have to get our metabolism working in such a way that we can use that fat.
Mm.
When we use it, then we make ketones. And last time we talked about the keto diet, the ketogenic diet, and how important that was for the metabolism. Well, it's also important for the nervous system. And so some people, they'll tell you, oh, you should drink this drink, and you could pour these ketones in it and drink it down and have that for breakfast, and then you'll have ketones. The problem with that is you have ketones and sugar, and the cells are going to use the sugar instead of the ketones. We really only use ketones when there's not sugar available or when the sugar levels are low. So just having ketones isn't enough. It's really important that the sugar levels are down too. So eating less sugar is part of that, and that's what we talked about last week in the ketogenic diet. Is it wasn't enough just to take ketones or to eat coconut oil or to have more fat in your diet. The other side of that is you have to decrease the carbohydrates. So that's one.
Oh, we lost audio.
Fasting.
Oh, we lost your audio for a second there, but now I think it's coming back.
Once a week, once a month, and generally like once a month, 3 days of fasting is really good. Dr. Longo at USC, at the Longevity Research Institute, he advocates a 5-day fast mimicking diet, in which you can have small amounts of calories. I usually put people like on a bone broth or a juice or something like that, vegetable juice, not something with sugar in it. And that's another way. So number one is taking out the carbohydrates out of your diet. Number two is periodic fasting, which would look like 3 to 5 days, once a month. And then after your metabolism is more normal, doing that once a quarter, so every 3 months. And then the third way is to get your adrenal glands functioning well. And the way we do that is something that we talked about last week as well. And that is not eating after 6 o'clock, eating breakfast in the morning at 8 o'clock, and then going to bed by 10 o'clock. That gets your circadian rhythm in the proper balance, that gets your metabolism working properly, and you do all the repair and cleansing at night while you're asleep. And that will prevent it, just doing that.
Yeah. So it's kind of, I think, as we think about our bodies as systems, and we think about our cars, and we have to get oil changes regularly. We have to change the air filters. We have to put fuel in the tanks and things like that. And so just like, and our bodies are even more intricate and obviously important. So I like those those tips of, you know, the once a month clean out, the 3 days or 5 days of fasting, in addition to, yeah, the don't eat after 6 p.m. and the adrenal glands. So very good information and helpful tips that we can implement like right away, right now, today, and start seeing. And this isn't something that you won't notice an immediate difference. You'll see that, but you'll also be making, you know, improving your long-term health as well. So, yeah, that's great. So I was watching a documentary the other day on Bill Gates on Netflix, I think it was, and they asked him, what is your greatest fear? And he sat there for a little while, and he's thinking, and he said, to lose the ability to think, or to lose brain power or brain capacity, and basically to get something like Alzheimer's. And when he said that, it's like, yeah, I mean, there's a lot of things that you could say, or you think about what is your greatest fear, but when you think about Alzheimer's, it's such a
Yeah.
tragic disease, and
Oh,
what effect,
totally.
yeah, what it does
I
to your, yeah,
I have I have people in the nursing home who are famous people, famous artists. Here at Santa Barbara, people from Santa Barbara who have done amazing things with their lives, who have, you know, millions or billions of dollars to spend, and they can't do anything because their brain doesn't work.
yeah.
It's really, like you say, tragic.
It is, yeah. Can you talk a little bit more about that? Like, as you see patients and you see their families, what does it do? Like, how does it affect the families and people around people that get Alzheimer's?
Well, let me start with in my own family. When I was 16, we moved into my grandparents' house because my grandfather was developing Alzheimer's. And it was really hard for grandma to take care of him. So my mother, my father, my brother, and I, and then my grandma. So there were 5 adults taking care of one man with Alzheimer's. And let me tell you, it was hard. It was really hard. It was heartbreaking to see grandpa running down the street in his underwear and grandma running down to get him, and him yelling at her saying, "Get away from me, I need to go home." And she's crying as, you know, dragging him up to the house, and just she's bawling, and he's yelling, and
Mm,
so heartbreaking.
yeah.
It was something that I was like, okay, I do not want that. What can I do? So I've been doing a lot of research over the years. What really works to prevent Alzheimer's? And those 3 things that we talked about are pretty simple,
Mm,
and you can prevent it. And even in the early stages, Dr. Bredesen showed you can reverse it. The families that I see here in the nursing home, most of them are kind of heartbroken too, because they want mom or dad to be at home. They want to take care of their parents. But gosh, if you've never done it, you don't understand how hard it is. You don't understand
mm,
what, you know, when you can't get any sleep at all, because this person is up at any time, and walking outside and running away and getting lost, and doing stuff that they shouldn't be doing,
mhm,
urinating in places that they shouldn't be, and all of this things that they the caretakers are like, what's wrong with me that I can't take care of my own father or my own mother or my grandparents? It's just not that easy. We have here at the nursing home, we have 24 hours a day. We have nurses, nursing assistants. There's somebody awake and available all the time, and it's still hard. It's hard
mm,
for everybody.
mm. Yeah, it's sad. It's and it changes the memories that you have of your loved ones too. Unfortunately, towards the end of their life, and you forget sometimes the good times and their personality, and just the hurt that, you know, as you talk to someone and they don't remember who you are, and you just spent your whole life with
Yeah,
them. So yeah, it's really tragic.
yeah,
Yeah.
definitely tragic.
So this is very important for us to teach people. So let's talk about let's say that that we are personally or someone we know is starting to develop some signs of memory loss, of dementia, or what are some remedies that we can do? I'm assuming that the three preventative strategies that you talked about would be helpful, but what else can we do when we start to see this happening?
Absolutely. That's a really good start. Are those three things. But it's only a start. The other things that are needed are nutrients. There has to be not just adequate nutrients, but extra nutrients. So very often, even when in like Dr. Bredesen's book, he talks about vitamin B12, and even when people have like what are called normal levels of vitamin B12, that doesn't necessarily mean that they have sufficient, and they often can use more. What is helpful in reducing inflammation, and so on top of cleansing, repairing the nerves and helping the nerves by having vitamin B12. And I usually recommend injections because very often if people are low in vitamin B12, it's because they don't absorb it well. And if they're not absorbing it well, you can take pills, but you're not going to get it. You know, it's not going to get into your body just by taking pills if you're not absorbing it well. Whereas when you get an injection, it's all going in there. Yes, you're going to pee out part of it, but you're bathing your cells in this vitamin B12, which I have found to be helpful in many cases. I've had cases of people who turned around rather dramatically with just B12 injections.
Where can the average person get a B12 injection? They just go see their doctor? Is that pretty common?
Yeah, it's pretty common. Any doctor can prescribe it. Any naturopathic doctor can prescribe it. One of my patients, her husband is a vet tech at a veterinary, a veterinarian, and he says, "Oh yeah, we can get it from the veterinarian, and we can get the syringes too." So he just brings them home, and she gets the injections from that. In Buellton, near where I live, they have there's a store, a Mexican store, carniceria, and they actually have it there because it's a vitamin and it's over the counter, and it comes in these little pre-filled syringes. And so I know a lot of the Mexicans that I've worked with have that. So you can also, if you don't want a doctor to prescribe it, you can order it overseas and have it delivered to you.
Okay.
Yeah.
Yeah, interesting. Well, so a quick note to our attendees. So this is a this is a webinar that we would love to have interaction with everyone on here. So if you have any questions, you can use the Zoom software to ask that. Looks like we have one that came in here, but also you can raise your hand, and if you want to like come on live, either on video or on audio, we can give you controls to ask Dr. Saunders directly that question. So, and yeah, also just quick note, my goal is to keep these webinars to around 35 to 40 minutes. So we've got another 20 minutes or so today. So it looks like, yeah, we've got a question come in here, and I think Leslie, you're going to hop on. So we will wait for you to join us, and that'll be great.
Hi, guys.
Hello.
So I actually have two questions. This first question I'm wondering is, when people have Alzheimer's, are they aware that they don't know what they don't know, or are they not aware? I guess would be the first question. And then the second thing I'm wondering is, if we've had new people that are hopping on, can you go over those three steps that you would recommend for Alzheimer prevention again?
Okay. First question first. When people have Alzheimer's, generally, almost always, if it's Alzheimer's, because there's other forms of dementia, and that particular type of dementia, they are not aware. They don't know that they don't know. And so what happens is they have something called confabulation. And that means they just make up stuff. They just start saying stuff. And to them, they're not lying. It's not like they're purposely making stuff up to lie about it. It's that this is what's coming out of their brain. So when you say something and you say, oh, I remember this, and you tell a story, the story is just coming out of your brain, and it's just naturally flowing out of your brain. But what flows out of their brain is not reality. And so you'll say, oh, wait a minute, what was that? That's not the way it was, or that's not the way it is. Or often especially with names and certain nouns, they'll have they'll use pronouns instead of nouns. So they'll say that, or it, or him, or her. Instead of using a name, you'll go, who? Oh, you know, him. And because the name doesn't come out, but the pronoun does. And that's kind of the confabulation that often happens. And that's one way to tell early Alzheimer's, is when people start using pronouns instead of nouns and they're not aware of it. And sometimes they'll get frustrated and say, this is obvious, isn't it? But they're not aware that, they're not saying, gosh, I'm really worried that I can't remember. They don't say that. They don't know. Okay, so the next thing that your question is, what are the three things that we do to prevent Alzheimer's? And number one is to avoid carbohydrates, and especially this would be simple carbohydrates like sugars. Small amounts aren't going to be an issue. Occasionally, not going to be an issue. But when we have sugar all day long, every day, and especially when we're told, and this is the worst thing of all, we're told, eat 5 small meals a day with snacks in between, so you never have an empty stomach. That's the worst advice you could ever give to somebody. Number one, it's not true. You still can get hypoglycemia. But number two, you're always making insulin. And it turns out insulin is the big culprit in this. Insulin is what causes the problems because it causes downregulation of the proteins that bring sugar into the nerve cells. So the nerve cells are like, we can't get any energy in here because everything is blocked. And so without energy, things just stop working. Just like if your light bulb, like someone turned off the light switch, it's not going to work without the power getting to it. And that's what's happening to the brain in Alzheimer's. And it's kind of ironic. You think, your brain is, outside the brain is just swimming in sugar, and there's sugar everywhere, and you're eating all this sugar, but it can't get in. It can't get past that blood-brain barrier because there's not enough proteins to allow it. That's why it happens. So number one, cut out simple sugars. Just, if you just cut it out entirely and say, I'm never going to eat powdered or white sugar or any kind of processed sugar again, that would actually be very good for you. Number two, fast periodically. And that would be ideally like do some kind of cleanse, like 3 days or 5 days once a month or once a quarter. That 3 to 5 days reverses the problem of getting sugar into the nerve cells. It increases the proteins that let sugar in, so that you finally get fill your brain with energy. And then number three is cleanse period. Oh, and number three is to fix your adrenal glands. And your adrenal glands work best on a circadian rhythm where you eat breakfast by 8 o'clock in the morning, around 7 o'clock in the morning. You stop eating by 6 o'clock at night, and you go to bed at 10 o'clock at night, and go to sleep at 10. And that gives you a good circadian rhythm.
That's great. All right, we had another question regarding the difference between Alzheimer's and dementia. What's the difference?
Okay, excellent question. So Alzheimer's is one type of dementia. And so in the old system, the only way to diagnose Alzheimer's disease is with a biopsy of the brain. So unless you've taken a piece of the brain and you can prove that there's neurofibrillary tangles and this characteristic structure in the microscopic structure of the brain, then you don't know you have Alzheimer's. You just say you have dementia. So they say dementia of the Alzheimer's type. And so you have Alzheimer's type of dementia maybe if you don't have a biopsy. But now we have something called SPECT scans and functional MRI scans where we can see Alzheimer's disease before any symptoms show up. So we can say this is Alzheimer's because of characteristic loss of function or loss of use of the hippocampal areas and the frontal lobe. There are other types of dementia. Some people have multi-infarct dementia where they have their carotid arteries are half blocked and they get breaking off little clots that go up into the brain, and they just plug up arteries all over the brain. And so they're causing dysfunction, little bits of dysfunction all over, which leads to a type of dementia where you lose cognitive function. But people usually with that will say, gosh, I think I'm losing my brain. I can't remember things and I can't think clearly and it's not working right. So it's different than Alzheimer's. And there are other kinds of dementia, Lewy body dementia and other problems with the function of the brain.
So I've got an interesting question that just came to mind. So in traditional medicine, in your world with other doctors and hospitals and things, is there any controversy in what you're talking about with avoiding carbs, fasting, the 6 p.m., 10 p.m. rules, as opposed to, what are traditional medical doctors saying to do, which you don't?
Well, generally, most of the oncologists are saying that Alzheimer's disease is not preventable, not treatable, and it's genetic, and there's really nothing you can do about it. That's the general rule, because if there's no drug to treat it, then it's not considered even a real illness as far as medical doctors. Because you remember, if you're going to a medical doctor, they're going to give you medicine. That's what we're trained in. We're trained in medicine. And so if there's no medicine, then there's nothing to do. And then you say, okay, there's nothing there. There are some medicines for dementia, Alzheimer's disease, that increase the acetylcholine in the brain. However, they don't slow the progression of the illness. And so that's why they say there's nothing you can do about the progression. It's just going to happen.
Yeah. So it's important for people to realize that we're kind of bucking the traditional and what medical doctors, like you said, are saying. There definitely is, there are remedies that you can implement that will be helpful for them.
Yeah, and what's really interesting about talking about the genetic part, there is a genetic component, but it's really small. It's like 4%, 10%. It's not even people who have the gene, they may have a third more risk, but that's not even a majority. So there's not enough to say, oh, it's a genetic disease, there's nothing you can do about it. Clearly 2/3 of it or half of it or more is lifestyle and how you live your life.
So if somebody has diabetes, how much greater risk are they currently at to get Alzheimer's?
Oh, huge. It's over 50%. So like 60 to 70% of people with type 2 diabetes, insulin resistance are at risk for Alzheimer's disease.
Wow.
They say if you have a brain, you're at risk for Alzheimer's disease because they don't really know what the risks are. Yeah. But clearly a metabolic problem like diabetes is a huge factor. It's big.
Wow. Yeah. So basically type 2 diabetes is a warning sign that Alzheimer's is pretty much in your future if you don't take corrective actions quickly.
Yeah. And the tragedy is you don't have to wait till you have Alzheimer's disease or you wait till you have diabetes. So if you have insulin resistance and never have diabetes, you can still get Alzheimer's dementia. That's why some of the researchers are saying we should characterize this as a type 3 diabetes, because it's the first manifestation of it. It's not, there's no high blood sugar, there's no, obvious other manifestations of it.
So it goes back to the insulin more so. So you could see it in your insulin levels.
Yeah, insulin resistance would be an early way of detecting your likelihood or your risk for having Alzheimer's also, yes.
Okay. So a test to get whether or not you have diabetes, like that insulin, I forget what the name of it was, but what would be a good test for people, even if they're to see whether it's Alzheimer's or diabetes, but to check their insulin?
Well, most labs in the country are now doing an insulin resistance test. It's a insulin resistance index.
Okay.
And that one's pretty good. If you don't have that available, then you can do an insulin level and at the same time do a glucose level. So if you do the glucose and insulin, then you look at them, and if the glucose is high and the insulin is high, that means you have a lot of insulin resistance. If the glucose is low and the insulin is high, then you have more insulin resistance. And if the glucose is high and the insulin is low, then you're good.
Okay. Huh.
Or not necessarily high. If the glucose is normal, insulin is low. So you want as little, especially on a fasting specimen, you want as little insulin as necessary. You want the minimum amount that you can possibly have.
Yeah. All right. So we have someone that has a question to hop on here. Skip is joining us, and looks like he is about to be given. I think he is muted right now. But Skip, if you want to unmute yourself, I think you're on. Go ahead, Skip. I think we can hear your background noise, but maybe not I don't know if you're saying anything yet. Testing, Skip. All right.
I'll hop on and ask Skip's question.
Okay.
Since I can see it. I'm not sure why it's not working, but let me see what he asked. Okay, Skip is wondering, by the way, I'm Leslie with Barton Publishing, everyone. So hello, you guys are all welcome to hop on here and ask questions. This is kind of a pretty awesome opportunity to chat with these guys. So I just would really encourage you guys to take advantage of this. You can just comment in the chat that you would love to ask a question, and I can unmute you, or if you want to do video, that's even better. So feel free to do that and just let me know in the chat. But Skip is wondering what level of ketones is healthy.
Joe, you can answer that. We talked about it last week.
Yeah, so I've been testing my blood sugar and my ketone levels with a monitor from ForaCare, which is a good one. And typically, if you're in ketosis, your ketone levels are going to be over 1.0 as far as the level. And I don't know what that means. It's like so many millimoles per deciliter or something like that. So, but yeah, anywhere from 1 to upwards of 6. It really depends how far into ketosis you are. But yeah, so I'd say anything above 1 is healthy.
The fact that you can make ketones above 1 is a good sign. That means you're able to burn fat. People with a lot of insulin resistance, because insulin is high all the time, it blocks the fat cells from bringing out fat and using it for energy. So the fact that you can make ketones is a good sign, meaning you can clean out your brain and use ketones for your brain too.
Skip, if you're able to type in an answer to this question, I'm just wondering like what ketone levels you've seen personally, and then we can comment on that. So there's another question that Pam had asked us was about your comment about buying B12 injections overseas and the safety of that. I suppose it's hard to know, like I'm sure there's a lot of different places you could buy them. So I guess you'd have to use your best judgment. But best case scenario would probably be to find a naturopathic doctor locally and have them do it, I would assume. But do you have any more insights on the safety of buying something like that overseas?
As a rule, in the world there are only a few manufacturers, and so as long if you look at who the manufacturer is, that's the best way to determine the safety. And
Yeah.
so it's kind of interesting that the drug companies are now buying up the vitamin suppliers and now supplying vitamins. So you'll see like Smith Klein on your vitamin B12. It'll be what? How does that work? But that's the way the world's going. So that's what they're doing now.
Right. They're no dummies. They're following the demand of what people are looking for. So I mean that's good in some way, I guess. Although eventually they're going to jack up the prices, and that won't be good.
Well, not eventually. It's already happened.
Yeah.
Vitamin B12. We used to
Yeah.
buy a 50 cc vial for $10, and now a 1 cc vial is $20.
Ooh, wow. So that's a 200 or 2,000% increase. Yeah. Well, thanks, drug companies. Another way. Yeah. Let's see. Okay, so this is a bit of a random question, but as I was looking at your background with the trees, and I'm looking outside at the windows, but earthing, like might not have anything to do with your brain, but what does like getting outside, breathing fresh air, and even like walking barefoot on the ground, what does that do for your brain?
Gosh, that's a really good question. I know what it does for your metabolism and your general demeanor. One of the things about the brain is it controls everything in the body. And the part of the brain that controls everything in the body that it starts with, the beginning part, is the emotional part of the brain. So being outside, earthing, touching the earth, being connected to people and to things. What?
Hugging a tree, being a literal tree
hugging trees. Yeah. So being connected to people and things, having a garden and digging in the garden and accomplishing things. All of this improves your the emotional part of your brain, which then allows your metabolism to function better, your adrenal glands function better, you have less stress. And if I could emphasize that, one of the important things that are those adrenal glands and that stress. If you are getting out in the sunshine and you decrease your stress, that's huge. We talk about, you have to eat these certain kinds of foods, or you have to do this much exercise, or take these drugs. Drugs have maybe a 3 to 10% effect overall. Supplements, getting the right nutrients is much higher, like 30 to 40, but stress is way above that. It's like 90 percent of the effect on your body is controlled by stress. So actually, that was a really good call.
Yeah. Well, speaking of stress, it's another thing that we can do and that we often forget to do is just to take a deep breath. So like everybody right now, let's just like take a big breath in. There's something about breathing that just like so refreshing, and we can do it at any time, any place. So do that often. Breathe well, breathe deep. Okay, so we had another question about ketones from Kathy, and she is wondering, how can ketone levels be increased, or can they?
Ketones are made when you burn fat. So the people that tell you should drink your ketones, that you can put this powder ketones into your drink and drink it down, that's not the best way. The best way is when you're burning your own fat on your body, because you have so many more benefits from those enzymes that are starting that fat burning metabolism. So the way to increase your ketones is to eat fewer carbohydrates and allow your body to burn the fat that you have on your body. So fasting is a great way to do it. Not eating after 6, you should have ketones by the morning. And then the way we do it in our program for diabetes is to lower the carbohydrates to, less than 20 grams of carbohydrates a day. Those are all ways that you can increase your ketones.
Yeah, if you're eating less than 20 grams of carbohydrates per day, plus your body will switch its fuel source from carbs to fat. So that's like your machine is working optimally.
Yeah.
So yeah, it's really just eliminating carbs, below or at 20 grams or less, which is not very many carbs. Like you could take a couple sips of Coke and be fat for the day. So you don't want to be, don't drink your carbs. That's a big thing.
Done.
Yeah. So your carbs should be healthy carbs through vegetables and maybe a couple berries and things like that.
So another way that people might have heard of is you can eat coconut oil to increase your ketones. And that is actually true, that coconut oil, there's a certain oil called the medium chain triglyceride oil that's in coconut oil that goes, instead of being processed, going through the body and being stored, it goes through the liver and is immediately made into ketones. So then it raises your ketone levels. Mm-hmm. And I've heard reports of people who just eat coconut oil to raise their ketones and don't change their carbohydrate intake. But most people, the carbohydrates are the preferred source, sugar is the preferred source of energy. So most people won't make ketones if they're eating carbohydrates.
Speaking of coconut oil, that was something I had forgot to mention, but like that's one of the best things for your brain because it's a fat, and I think specifically the MCT oils, medium chain triglycerides, like that's just directly feeding your brain healthy, nutrients and fat that it needs, because your brain is mostly fat, right?
Yeah. And that medium chain triglycerides are made into ketones, which is a low octane fuel to help you restore and repair your brain too. So there's more than one thing going on there.
Yeah. So low octane basically means there's less waste and less toxic.
Less inflammatory mediators, less oxygen-free radicals.
Yeah, we'll have to do another topic here on our webinar covering stress and all the different ways that we can reduce that. That's important.
Great idea.
It would be good. Okay, so I think we're going to wrap up here. We've had a lot of great questions here. Let's see. Oh, we've got one more question from Henry here. I want to look at this quick. So Henry says, I've been diabetic for 14 years, but for some years now, my blood sugar is always higher in the morning, even if I sleep without food. What can I do to maintain a normal blood sugar? And I think this actually gets into stress from what I've seen personally. If I'm stressed or if I don't sleep well enough, blood sugar numbers are higher. Is there anything else that we can?
That's one reason. The other possibility is that sometimes when people they skip dinner, they don't eat at night or something, their blood sugar drops low, and because they have a lot of insulin, it stimulates their liver. The blood sugar starts dropping low, and tells the liver, oh no, we got to make some more sugar. So it's called gluconeogenesis, and they take your proteins and make sugar, or take the glycogen out of the liver to raise the blood sugar, so that by the morning time, you've in the middle of the night while you were sleeping, your blood sugar dropped low. And then by the morning time, it's come up, and it's come up higher than it was before, because that's the reaction that the body's having to that low blood sugar at night. One of the things that we were told was, eat something before you go to bed. But a better idea is to change to a fat burning metabolism, so that instead of getting hypoglycemia, you can immediately switch to fat burning and then just go on like normal and not have that stress reaction of your blood sugar going up.
Yeah, very good. Speaking of hypoglycemia, I believe that's what we're going to be talking about next week. So next Tuesday, 10 a.m. Central Time, we hope that you guys can join us again. live on these webinars. We do these webinars to help you, our subscribers to Barton Publishing, and wanted to give a quick shout out to, for more information, if you're looking for, if you don't already have a copy of the Diabetes Solution Kit, where we teach the full diabetes reversal plan, phase 1, phase 2, phase 3, you can find that at, just go to bartonwebinar.com, and you can see we have the solution kit there. We have the supplements like Synachroma, which is our blood sugar metabolism support formula that has cinnamon and chromium, vitamin D, vitamin K, selenium, and vanadium in it. You can get them right from bartonwebinar.com. And also you can learn more about Home Cures That Work, which is the membership site that we publish. Dr. Saunders writes a monthly article there covering all sorts of different topics. You've been writing for almost 11 years now, I believe it's been. Amazing wealth of information there, and your articles are always so good. Learn so much from them. So check out homecuresthatwork.com. That's also linked from bartonwebinar.com. And so, yeah, thank you all for joining us today. This has been very helpful and very informative. So just an encouragement to you guys, to everybody, to really think about your future, not just your day-to-day, not just today, but you thinking about, like, all right, what do I need to do today that's going to give me benefit in the future? And I think the strategies that Dr. Saunders has taught today are so important. Occasional fasting, the avoiding, simple carbs and minimizing those sugars, keeping your carbohydrates low, and then stop eating at 6 o'clock at night and be asleep by 10 p.m. And we've talked in previous webinars about how the human growth hormone is optimized at that time. And really, you have to be asleep by 10 o'clock for that to happen. So all of our webinars are available on our YouTube channel. Click the subscribe button on YouTube to be notified of future webinars that we're doing live. And we love to just have people participate, ask questions. And yeah, that's it for today. Thanks for joining us. And Dr. Saunders, as we close here, Leslie's going to probably stop recording and people will be dropping off, but you've got a pretty good joke to share.